Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. All right, this person says, I came in late on the portion of the interview when you talked about visitor restrictions at Cone Health. Can you explain how it's working at Cone now and what the hours are?
Sure, I'll be brief. Simple answer to the hours: visitors 10 a.m. to 8 p.m. Generally speaking, it is one visitor or support person per patient per hospitalization, with some exceptions for pediatric patients and a few other patient classifications. One visitor per patient.
Okay. This person is asking, can you explain why the COVID death rate in Guilford County is higher than in many, if not all, counties in North Carolina?
Sure. I might debate the question a little bit. The death rate in Guilford County is maybe on the high end. It certainly isn't the highest in North Carolina. We could certainly get into the data there if we wanted to. One of the issues that we've experienced in Guilford County is the number of patients that we've taken care of who are residents of nursing homes, and those patients generally do worse than the rest of the population. They're older, multiple comorbidities, and a number, unfortunately, skilled nursing home residents have died from the coronavirus.
Okay. Someone is asking, are hospitals seeing more children getting coronavirus?
Generally speaking, hospitals aren't, meaning more pediatric patients, children, are not being admitted to hospitals. There are certainly some children who've been admitted and have been very sick with SARS-CoV-2 virus, but we're not seeing more of those get sick. I do think a number of pediatric patients, children in our communities, have the coronavirus and might be spreading it amongst themselves and to others, but generally not admitted to the hospital.
Mm-hmm. Someone's asking, if a person dies from coronavirus, is that person still contagious?
I'm going to answer that with a no. I think there are particular things that need to happen when people are handling the body, but after the patient is out of the hospital or the home, they're no longer contagious.
This question just came in. If I'm sitting at my desk at work, but I'm not too close to others, should I still keep my mask on?
Yeah, the devil's in the details there. If you are in a large room with a number of people in that room, I think you ought to wear a mask. Most of us aren't going to carry a tape measure around and make sure that we're 6 or 10 feet away from people. If you are in your own office, then I think it's safe to take your mask off. But if you're in a room, wear the mask. It's the safest thing to do.
Is there any thought that the virus could die out once the weather gets cold again?
Yeah, I wish it were that easy. We started this journey when the weather was cold, and we were very hopeful, although there wasn't any science behind it, that the virus would die out when it got hot. It's been plenty hot, so that's not going to happen, and we shouldn't expect that the virus is going to die off when it gets cooler.
Mm-hmm. Someone is asking, do I need to wash my mask with anything special, or can just regular laundry detergent do it?
Regular laundry detergent is going to take care of anything that's on your mask that could be contagious.
Mm-hmm. Very quickly, is COVID toes a real thing?
Say that again, is COVID?
Toes.
COVID toes. You know, I think I've heard that term several weeks ago. I can't remember what the classification or what the definition of that is. Generally speaking, the answer is no.
Okay. Thank you so much for going through so many of those questions so quickly. Thank you for texting your questions. We want to continue to work to get you the answers that you want.